which has a lot of side effect and toxicity and all that, and people are talking about immunotherapy. The big highlight of immunotherapy is trying to use your own cells to fight the cancer cell and destroy the cancer cell. So that's the newest treatment, and then we've been seeing news about various centers trying to start this, and India is now coming into the forefront of that. And the newest form of treatment in that immunotherapy is called CAR T-cell therapy. It's called chimeric antigen receptor T-cell therapy. That is, what you do is you take the cells from the patient, the T-cells, you collect it when they're well, change one receptor so that can identify the cancer cell, and then put the cell back. Then that will go back and kill the cancer cell in the patient. Okay? So now this is the latest form of treatment for cancer everywhere in the world, and in the US a lot of patients have started getting this, but it is something which is horrendously expensive in the country, and for us to be for it to be affordable to our patients, we needed it to happen in our own country. So unless production and treatment happens in our own country, the cost will not come down. And the classic example is for bone marrow transplant, which you anyway got proof now, that earlier what used to cost 1 to 2 crores in the US is now available for 1/10 of the cost in our country. And there are close to about 100 centers in the country doing bone marrow transplant now. Even 20 years ago when I started out my practice, there were less than 10 centers in the country who could do bone marrow transplant. So using that same analogy and example, we are now saying that this treatment is also available for our own patients, and clearly we are seeing now the benefit of that. Now, looking back on the treatment, Mr. Khan will tell you what exactly he had to go through. So, all of us remember our COVID pandemic, everybody was. So imagine what happens to a patient who during that time gets some disease like this. If you have a disease like cancer, you can't sit at home and say, I will not do anything, you need to get treated, And he's somebody who went through that kind of treatment, then came out of that, but unfortunately had a relapse again, and when it relapsed again, even the chemotherapy treatments were not working. So at that time, we got him to, come into our center, and at that time this kind of treatment was being initiated for the first time in the country, and he was eligible to kind of undergo that treatment, and his cells were collected and then put back, and he's now one of the longest survivors now, definitely in the state for sure, that I'm sure. He's also one of the longest survivors in South India, because there's no other patient from South India who's got this kind of CAR T therapy and gone beyond, I was actually going to say 1 year, but just last week he crossed 1.5 years, and his recent tests and blood scans and reports and all are absolutely normal. So in diseases like cancer, we have milestones, so everybody talks about the first 6 months survival, 1 year survival, 2 year survival, and then you want longer 5 year survival, and after that it's basically cured. So we are looking more and more towards that kind of milestone in him, and that's why it's a big moment for us to say somebody who's crossed that, first of all, the 1 year landmark, and now he's actually beyond 1.5 years. So looking at that success, we want to say that this is something which will be available for patients in our own country, who cannot even sometimes tolerate chemotherapy. If you have an elderly person with a lot of comorbidity, such story we will actually get from him, from Khan himself, so he can tell you what all he had to undergo to actually come out and stand like this in front of you all today. So I will stop here and allow Mr. Khan to then talk to you all, and then post that we will address whatever questions and queries you all have to regarding either the treatment or its success rates or.
It gave a result initially, but in a matter of 6 months it relapsed again. Then I was going nowhere, and one of my close family doctor has suggested that you have to go to the best, who is at the best in immunotherapy as well as the BMT. Then only I came across Mr. Dr. Sharad Damodar. So I went to him. So before that, the typical regimen in chemotherapy was like you lose your hair, lots of side effects, you will not be active in your day-to-day life, and all that stuff I underwent for almost 2 years. Then after coming across Dr. Sharad Damodar and his team, then they have enrolled me into this CAR T cell. So I would say, as far as the CAR T cell therapy is concerned, not every patient can be enrolled. There are certain selection criteria is there. So I have crossed that, or I have passed that selection criteria. Then they have enrolled me. So my experience with this treatment regimen is, I would say, very, very limited side effects. Rather, I would put across zero side effects, and I have started my day-to-day normal life